Hey everybody, this is Dr. Daniel Choi from North Texas Dental Surgery, Wisdom Teeth and Denture Implant Center.
I'm Dr. Tyson Koo.
All right, guys. So we pulled a video recently from our Instagram. By the way, if a lot of you guys don't know, we actually do have an Instagram and Facebook, and it's at North Texas Dental Surgery, so you can see it below. And also, we recently started a TikTok, right?
Yeah.
So yeah, North Texas Dental Surgery. Subscribe to that, and you'll see videos of Dr. Koo dancing. Just kidding. I think that's the biggest reason as to why, like, I thought like people on TikTok are just dancing all the time.
Yeah, maybe I should start dancing and singing.
If it gets the subscribers, right? But anyways, a lot of times patients want to know kind of like about what's, we have a video recently we want to share, and we're not just trying to share a video from our Instagram, but the reason why we're sharing this is because we're actually going to show you the end result and how he's chewing on the jerky, he's loving it. Yeah, he's
we like to perform like a bite test when the case is complete.
Right. Because what good is investing in all on four? And like, we all know, we've all seen photos. They look good. Okay, yeah, they look good, but how functional is it, right? So he's gonna actually be chewing on some beef jerky. Jack Link's, by the way, so he loves it. But he's chewing on some jerky, and it just shows the functionality. But we're not just showing you this video. We're gonna show you basically what he looked like before, and then also what his x-rays and his 3D scan look like, and basically how we were planning his surgery and where we ended up placing his implants. So let's show you the video of him.
All right, Victor, so you got your final set of teeth. Let's test them out.
All right, good piece of beef jerky. Perfect. It's actually really, really good.
Yeah?
First time I've eaten beef jerky in 3-4 years. These are beautiful set of teeth, and they fit perfect. They feel good. I couldn't ask for anything better.
Love it.
All right, so this was his final photos, and let's show you his before photos. All right, so these were before photos, and so patient's chief complaint, as many other patients in the situation, is, hey, I want to be able to chew again. And obviously, if I'm going to be replacing teeth with dental implants, I want to make it look good too, right? So let's talk about those options. How could we achieve that? We could do single implants, right? So patients might say, okay, well, can we do that with individual implants or implant bridges? Absolutely, we could do that. What are your thoughts about that treatment?
Or single tooth implants?
Yeah.
Can be done, but that type of treatment will require placing a lot of implants.
Right.
And
a lot of appointments.
In his case,
and maybe a lot of bone grafting even before the implants.
Yeah, and in his case, he'll probably need a combination of crowns on natural teeth and also implant crowns.
Right. So the individual crowns, and then also another thing is, what's the viability of those teeth, right? Because if those teeth are not that great, and then we're going to now root canal and crown those teeth, what's the expense that's going to go into that? And just root canaling and crowns, like with these teeth, like what's the time that we're buying out of all those options, right? Everything that we do is based off of prognosis, okay?
Yeah.
So maybe those options, like your existing teeth, are salvageable, and we could, if we just crowned them or whatever, we can get a good long-term prognosis out of it. And I'm talking about like 10 to 20 years, and maybe not, right? We have another patient who recently did all on four last week. She had a full mouth rehab with a bunch of crowns. She spent four different implants. She spent over $40,000, and she went about a year and a half before her teeth started breaking off, right? Yeah. And there was a lot of cavities underneath her existing crowns. So she was pretty upset the fact that she invested a lot of money and everything was going bad on her. So that's why she had to investigate the all on four process. But let's actually look at his x-rays here. Okay, so this is his panoramic x-ray. Right off the bat, I mean, this x-ray gives us a nice gist of it, but not very detailed information. You can see his sinuses here and here. Sinuses aren't that big, right? So that's good for us. See some huge cavities, teeth that are broken off, obviously missing teeth. One of the things that I'd see right off the bat is that if we did the individual implants, I know that we need to look at the 3D scan, right? So let's look at his 3D scan. Okay, so this is his 3D scan, but reality is that when we're placing a bunch of individual implants, we got to see the thickness of the bone. So this patient has had like what we call a pretty thick biotype, so his bone's actually pretty thick. Yeah, he would need some bone grafting here and there, but it wouldn't be that bad in regards to like how much bone grafting he would need. And what we're doing really is like we're measuring like the thickness of this bone and the height of the bone. So this is what is great, because we know ideally when we're placing dental implants, and we talked about this in previous videos, and we'll also have this information linked below. If you really want to delve into this topic, you could check out the videos below, because it goes very in depth in regards to like kind of like how we as dentists basically game plan whether you're a good candidate for dental implants, whether individual implants are all on four, and talking about what we're looking for again and how we plan the surgery. So when we look at this case, right off the bat, just to kind of like not, like talk about this ad nauseum, but long story short, it makes a lot more sense for this patient to do all on four versus doing individual implants or implant bridges.
I believe so.
Right?
Yeah.
Because we can avoid all that bone grafting, all the insane number of implants that we have to place. And long story short, without looking at the final numbers and giving a treatment plan of what the cost will be, all on four will save you about half. It should be about half the cost.
I think so.
Right? And the other thing is, even after a patient had invested that amount of money and those appointments, would we, in your mind, be able to get it to look as good as we did with the all on four?
Definitely not.
Absolutely not.
Definitely not.
Yeah. And there's a lot of mechanics that come into play in regards to soft tissue, like the gums and what everything looks like, and even there's just a lot of tedious work without going into details. But it's a lot easier to get a more predictable result with all on four for aesthetics than it is like with a bunch of individual implants. But anyways, so then let's talk about the all on four. So we made the decision, this patient agrees, we're going to do all on four, right? And so what we then look for is, let's kind of show you basically our logic of what we're looking for. So anytime a patient comes in for a consultation, we basically look at this panel, then obviously we look at the 3D scan. Dr. Koo, like in regards to like complexity for all on four, what are some of the things that you're looking for right off the bat?
So the first thing I like to look at are how big are the sinus cavities,
right?
And where the lower, what we call it, inferior alveolar nerve. So this is a big nerve that runs underneath your lower teeth.
Because we're trying to avoid those two structures.
Correct.
Right.
Yes.
But let's also talk about it. We talked about it in a previous video. There's nothing wrong with placing an implant in the sinus.
Correct.
But you're just not going to get any bony support from it. And we gave an analogy in our previous videos, again, linked below. But if you place a 2-inch screw and you're supposed to bury that whole 2-inch screw in the wall, and your drywall is only like half an inch thick, you're 75% of your screws hanging out in there.
Yeah.
You're not getting any support. Would you feel confident hanging something 100 pounds on the wall after that? No, obviously, right? So same concept. That's what we're trying to, like, we're seeing how big the sinuses are because we want to stay in the bone.
Correct.
Right? So I totally agree. When I walk in for a consultation, I see the x-ray, boom, looking at the sinuses.
Yeah.
Then looking at the inferior alveolar nerve. Then the next thing, we look at the 3D scan, right? So we look at the 3D scan because we're looking at basically how thick your bone is, right? And so we just mentioned this earlier. We said, all right, this patient actually, what we do is we measure your bone, right? So we see the thickness of the bone and we see the height of the bone. And the reason why we're doing that is we have dental implants that vary, like, if I open that cabinet back here, we could see basically all the varieties of implants we have, right?
Yeah.
So they come in very many different diameters and they all come in different lengths. The bottom line is we want to place as long of a dental implant and as wide of an implant in your jaw as possible, because everybody varies, like, in regards to like how hard they're biting, right?
Yes.
So they're these masseters, like how hard, and we've even seen like older ladies that you would swear like wouldn't bite down very hard, but they do, right? But we want to, long story short, if we want to basically over engineer and not just look at somebody and be like, you probably don't bite too hard. Like, no, we want to get as long of an implant and as wide of an implant within reason, though.
Yes.
Right? And we talked about this in previous videos too. But you don't want to place too wide of an implant. That's actually one of the reasons where patients can actually experience dental implant failure. Because if there's not enough thickness of bone around the implant, the bone can start dying off, then the gums can start receding, then you get peri-implantitis and you start experiencing a lot of issues. And you may think that everything's okay on day 1 or year 2, year 3, but you can actually start manifesting issues later on down the road. And so one of the reasons why we wanted to share these videos, kind of like how we conceptually think about these cases, is that a lot of times people basically commoditize all on 4, right? They think that, I just want to get all on 4. I'm just going to go on Google and get it all on 4 done here, and like nothing's going to go wrong, right? And I hate to tell you this, but like even in the last few weeks, how many patients have we seen in our office where things go wrong with all on 4? So they're coming to us for second opinions Hate to tell you this also, we had a patient who drove in from Missouri this morning, and we saw her case. She had 8 implants done up top, implants just hanging outside of the bone, weren't properly placed. She's already experienced, she had a 4 implant, implant bridge down here. It fell out of her mouth. She was holding it in her hands when she showed me it this morning. So, bottom line is you don't just place implants and get a perfect result. There's a lot of things that go into the equation in regards to, number one, how are we going to plan the case, right? Mm-hmm. So we showed you right off the bat that we looked at your 3D scans. We were trying to avoid your sinuses. We're trying to basically place implants as far back as we can, staying out of your sinus, so that we can avoid a cantilever. And we talk about it in previous videos, and if you haven't heard about that before, but long story short, we want to avoid a cantilever because you don't want to have a tooth out here with an implant over here and you're biting on your back tooth, and basically if it's unsupported and your last implant's here, you're going to create too much stress on the implant, parts breaking, long story short, teeth breaking off, implants failing, parts breaking, so you want to avoid cantilevers. So these are the things you look at.
Yes.
Right? Are there any other things that you're looking at?
Yeah, I like to definitely evaluate the what's called patient smile line. I like to see how much of the gum tissue the patient shows when he or she smiles.
Absolutely.
Yeah.
So we saw on this, let's look at that real quick. You can see right off the bat that you don't see too much of his gums,
Yes.
right? So that's what we're looking, right? So people sometimes say that, oh, that person has a gummy smile, but if you have a gummy smile, then that's an issue, right? So
yeah, it makes the case a lot more challenging.
Right.
And actually, at our practice, we see a lot of patients with what's called high smile line.
Right.
Yeah.
So the high smile line definitely affects basically how much bone reduction is.
Yes.
And without going into the complexity of it, it changes the angle of upon which you can place your implant and how far back you're able to get your implants. And also, it also affects your cantilever too, right? So the more your reduction you're doing. So those are many different factors. So long story short, so we planned on 6 implants for him up top and 6 on the bottom. So let's show you what we did. Okay, so there was definitely some movement with this X-ray. But what we see is we did place the implants in front of the sinuses, and we also did 2 pterygoid implants, right? And I did that to avoid a cantilever because where this dental implant was emerging, it was around the first premolar area, right? So if we had this implant on the first premolar area, and then our molar back here is chewing, then this is going to create a cantilever, and this prosthesis is going to break, or it's going to cause long-term implant failure right here. This side, we were actually able to emerge between the first and second premolar, but he was also still better off with a pterygoid, so that's why we did that. That's his wisdom tooth. We didn't take that tooth out. Someone might sit there and say, and this is not the patient's actually final teeth. These X-rays were from back in January, but these were temporaries that we put him in right at the time of surgery. But you could see that we didn't load this tooth because it wasn't stable enough. So what does that mean, right? So whenever we're placing dental implants, everybody's got different bone density, and we talked about it based off of what we saw. He looks like he has good bone density, but let's take a look at his X-ray. Basically, when we placed his implant, his bone was a little soft there, but because I didn't even need to engage this tooth at this time, so we basically we didn't put the teeth on this tooth, this implant at that time. So what are your thoughts about that, right? I mean, we know that's another thing people don't know about. So this is why we're trying to create these videos, is that we may have plans on placing an implant in a certain area, but if it doesn't go in with a certain amount of torque, you're best advised not to, especially if it's your terminal implant, your last implant, you don't want to load it.
Correct.
Right?
Yes.
So you have to have a certain amount of torque values or composite torque between all your individual implants. And basically what we're talking about, I know this sounds a little confusing, how tight is that implant going to your bone, right? So understanding that if I'm drilling into drywall, I'm not going to be able to get a screw to go in that tight because it's not very dense. If I'm drilling into a stud in the wall, like some sort of wood, then chances are that it's going to have more torque value because it's more dense, and therefore my screw is going to go in tighter. Same thing with bone, right? Everybody's bone's different.
Yeah.
You may have more dense bone in certain areas, and then you have softer bone in other areas. Now, there's also, this gets a little bit more complicated, but surgical experience teaches you, even if you have soft bone, maybe you can under prep the bone, and you have certain techniques
For sure.
to how to kind of work around it, right? Within reason, right? We'll definitely say that when we place dental implants for All-on-4 now versus when you do it years ago when you're more inexperienced with All-on-4 dental implant placement, you have surgical techniques that you can basically, how to deal with the bone, right? The bone densities and all that stuff. So that was another factor. But anyways, that's basically how we planned his case. And then you saw like the before and after. In the end, the patient was very happy about, the fact that he had his aesthetics back, right?
And, to get to our office, he used to drive like 4 or 5 hours each way. So I think that...
Is he that far?
Yeah.
Oh, shoot, I didn't know that.
So I think for him, in the end, I think that all the drives that he had to do were worthwhile, in my opinion.
Right.
Yeah.
When you get to be able to eat the food you want, you can eat them again, and that's something we take for granted, obviously.
Yeah.
And to be able to have that confidence and be able to smile again, I mean, it's worth it. And so, all on 4, well, all on 6, in this guy's opinion, in situation, worked out fantastically for him. Yeah. But we just wanted to share this case with you guys in regards to what he was looking for and what his present situation was and how we surgically planned his case and how things turned out. But if you guys have any questions about this, please feel free to leave any comments below, and we'd be more than happy to answer them for you. And we will see you next time. Thanks. Bye.